Welcome back. It's 11:38 a.m. This is the Mid-Morning Show with me, Julie Ali, and next we're going to be talking about bedwetting with Dr. Jonathan Buckley. He is, he trained as a pediatrician at Red Cross Children's Hospital in Cape Town. He did a 2-year fellowship subspecializing in children with kidney and bladder problems. He has his own practice in the southern suburbs of Cape Town, but he continues to maintain close relations with the kidney unit at Red Cross, where he is a honorary lecturer. So we're very pleased to have Dr. Jonathan Buckley to talk to us about this problem on the show. A very good morning to you. Welcome to the program.
Morning, Julian. Thank you for having me, and hello to all the listeners and viewers.
Okay, so bedwetting, we are told, is common in quite a large percentage of children. The one question I always wondered about is if a child had this problem and then they overcome the problem, and you'll tell us ways of how to overcome the problems, do these children then grow up into adulthood without problems, but when they reach old age, does the problem then present again? And if it does, why?
Julie, that's a very good question. So generally, once I think wetting as a child and wetting as an adult when you're older are two very different problems. So generally, yes, once a child overcomes their wetting, and that can be as late as middle teenage years or even late teenage years, then that problem shouldn't return. Because if you, and if it does return, certainly there, again, it does depend whether you're male, female, but yes, bedwetting as an adult it probably has more anatomical issues. For men, it may be a prostate problem, and for women, it may be linked to childbirth and the strain that that can put on the bladder and the urinary tract. So when it comes to children, if you look at the causes of bedwetting, there are really three things we look at. But maybe before we go on to that, it's important for children who are bedwetting. What we want to know is, have they ever had a period where they've been dry at night for more than 6 months? And if they've never been dry from the time that they were potty trained. Because if they've never been dry, we call that primary wetting or primary enuresis. And if they've been dry for more than 6 months, and then suddenly they start wetting again, that's secondary enuresis. And that is a very different topic, which we won't have time to discuss now. So we'll talk about the primary enuresis or bedwetting. And the causes of those are generally there are three things that can interact together. Some children may only have one, some may have two, or some may have three. And that's really, we're looking at what's almost common across all children that will wet their beds, is the fact that they don't wake up at night to the sort of messages that the bladder will send to them as the bladder fills up. So that is common in almost all children, and that's often why children may outgrow this problem, because as they get older, this what we call arousal center in the brain starts to listen to the messages it gets from the bladder, and so then one would wake up and then go to the toilet and empty your bladder. But that can take us all the way into teenage years for that arousal center in your brain to mature properly. The other reason that children may wet their beds at night is that, so what should happen is, as we go to sleep, we produce a hormone called antidiuretic hormone or vasopressin. And what that hormone should do is actually slow the production of urine down at night, because if that didn't happen, we'd all be up at night, probably visiting the toilet 2 to 3 times a night, and that would obviously be disruptive to your sleep, which the body craves. And so we, for some reason, we don't quite understand. It seems like it takes some children quite a time for this. They seem to lack this hormone. And again, it can take into their teenage years before this hormone starts to be produced. And so, yes, I mean, if you have a lack of the hormone, plus your brain is not waking up in response to the messages, gets to the bladder, you definitely have a problem. Then the third thing that can play a role is what we call a bladder that is overactive. So that's a bladder that, so what should happen as your bladder slowly fills up with urine, it will get to a certain point, maybe it's about 60 or 70% full, where it will give a little twitch, and then that is that signal you get, oh, okay, I can feel my bladder now. I probably need to go and empty it. And so then what you would do is you would go to the toilet, and then the bladder would contract. So with an overactive bladder, unfortunately, the muscle in the bladder doesn't give you this warning, and it suddenly contracts, and you're unable to control it, and so then you end up wetting. So sort of just back to your question, is that these three things. It's I say, lack of the ability to wake up at night in response to what your bladder is telling you. It is then also a lack of this hormone called antidiuretic hormone, and then possibly an overactive bladder. So those are the three factors that really play a big role in causing bedwetting.
Okay, we've got to go for an ad break, but let me leave you with a couple of questions which you will respond to right after the ad break. Oftentimes, a child is blamed, and a child is called naughty, or a child is called, very especially, when they reach the adolescent or teenage years, that they're careless, and they obviously parents become very, very fed up with them for the wetting all of the time. And I'm kind of wondering how this impacts on them emotionally. Does that further exacerbate the problem? What ought we as parents be saying to them and not saying to them? But all of that after the ad break. Thank you.
Okay.
Attention against their smartphones, you need to make smart choices, like using Sunfoil triple refined pure sunflower oil in every meal you make. It's naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether you're cooking, frying, or baking, you get the great tasting results that'll get their attention faster than the latest app. And if that doesn't work, change the Wi-Fi password. Sunfoil. Now we're cooking.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
World-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic, Sharia, and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
Operation Kurbani Maulana Timor will once again be taking a trip abroad for Kurbani. Many people in the villages live well below the poverty line and only eat meat on the days of Eid al-Adha. Support this cause at 2,100 Rand for 7 shares or 300 Rand per share. Contact Maulana Timor, Maulana Sajjad, Maulana Hamad or Maulana Abbad on 011 852 6324 or 072 299 9268 or 082 368 6866 or 072 697 0131 or 073 576 9786. All slaughtering will be supervised by a team of foreign and local ulama. Visit www.operationkurbani.org.za.
Conveniently located along the banks of the Crocodile River bordering the Kruger National Park, as a guest at Buckley's Africa Lodge, one can enjoy an amazing sunrise or sunset on our spacious deck area while you catch a glimpse of some wildlife sightings along the Crocodile River. The sounds of the African savannah will greet you whilst you enjoy your morning coffee. Buckley's Africa Lodge by Tingana Collection. Buckley's Africa Lodge is ideally situated only 6 kilometers from the Crocodile Bridge Gate in the Kruger National Park. Catering for all travelers with variety, we have 4 types of the finest rooms: superior rooms, deluxe suites, and 2-bedroomed family units. Each room is equipped with the finest amenities to make your stay unforgettable. Guests can choose between the self-catering option or book their accommodation with breakfast and dinner included. Buckley's Africa Lodge is your ideal location for the ultimate Kruger getaway experience. We specialize in exhilarating and educational game drives in Kruger, tailor-made to suit your family. Inquire about our various accommodation offerings and other activities. Visit www.tingana.co.za for more information. Buckley's Africa Lodge by Tingana Collection. Experience the pulse of Africa with us.
Listen to something fresh. Listen to Salam Media.
Welcome back. We're talking bedwetting with Dr. Jonathan Buckley. And of course, we've already touched on a few important issues. Dr. Buckley is a pediatrician and, of course, specializing in bedwetting is one of the problems that patients come to see him for. I left you with a few questions before the ad break, Dr. Buckley, but I also want to know if bedwetting is more common in girls or boys. And for those little boys who've been circumcised, is it more prevalent with them or not?
These 2 questions. So actually, under the age, actually across the board, bedwetting is more common in boys than it is in girls. For instance, at the age of 5, almost a quarter of boys will still be wetting their beds, whereas it's probably only about 12% to 15% of girls. And then, but those lines do meet once the children are 9, and then whether you're a boy or a girl, generally then about 2 to 3% of children will be wetting their bed into teenagers. So actually more common in boys. Circumcision doesn't really alter the rate of bedwetting. And then just back to your questions that you asked before the ad break, I think it's very, very, very important that the bedwetting is never a child's fault. They're not doing it out of naughtiness or out of spite. It is a physiological issue that they have that will improve with time, but they should never be remonstrated with, told that they're naughty, be ridiculed, be punished for wetting their bed. It's something that's not in their active control. And if anything, what the research has been very clear about is to try and use a reward system for positive behavior, and not positive behavior for being dry, but we know that yes, we may touch on the point about how do we treat children who are bedwetting, but one of the important things is non-medical treatment, and this has to do with making sure that they are drinking equal amounts of water throughout the day, not drinking for 2 hours before, or an hour and a half or 2 hours before they go to bed, making sure that they are emptying their bladder on a regular basis through the day and then before they going to sleep. not drinking drinks that are high in sugar or have caffeine, especially with the older children. These caffeinated energy drinks are becoming very popular. So it's encouraging them not to do these things that we know will affect their ability to be dry at night. And if they're doing all these things, then they should be rewarded. So really positive reinforcement is the way to go, not negative reinforcement.
You speak about energy drinks which are high in sugar. And very, very sadly, we do know that a lot of parents are giving their kids those energy drinks, which really are not for children. It's really for
No,
athletes and adults. What sort of
absolutely.
harm, what sort of impact will it have on children if they are fed regularly on those drinks?
Yeah, so I mean, it's two things. It's yes, the sugar content, and I'm afraid we know that in that children are unfortunately overnutrition. I think in a lot of developed parts of the world is a huge problem, and it's resulting in a lot of childhood and teenage and adolescent obesity, and we know that this will lead to diseases of lifestyle, so high blood pressure, diabetes, heart disease, early strokes, and all of these things. So really, these high sugar content drinks are not good for one. And then also, what people don't realize is these drinks have a very, very high content of caffeine. And certainly, there have been instances where young adults or teenagers have become very, very ill because they've consumed and become too many of these drinks in a day and become really toxic from the caffeine. So yes, long term, they're really not a good idea. And as you said, they should be used in the right context. You know, if you're doing intense sports or sports of long duration, and you need to replenish all the energy that you use. But outside of that, no, they should not be used by children.
When would you decide as a pediatrician and pediatric nephrologist that
Mhm.
a particular child or a particular group of children now need to go on medication to control their wetting?
Mm.
How extreme does that situation have to be where you go the medication route, and how
Mm.
effective is
Okay.
medical treatment?
So it depends on the age. So yes, certainly children who are going closer to teenage years or sort of over 9, really, because we know that those children over 9 who are still wetting on a regular basis, so basically every single night, these are the children that we really want to help with their symptoms, because if we don't help with their symptoms, it certainly can start affecting them psychologically. Perhaps they don't want to go to school, and they certainly don't want to go perhaps to sleepovers, and certainly don't want to go on school camps or sports tours, because they know they're probably going to end up embarrassing themselves. So certainly from 9, and then certainly if they are wetting every single night. And so, yes, as I mentioned, it's very important. The non-medical treatment is almost as important as the medical treatment. Then the first line of sort of a treatment would be actually trying what we call these wetting alarms. So the idea of them is that they will detect moisture. And as soon as they detect moisture, an alarm will go off, wake the child. Then they should wake up and look, oh my goodness, I shouldn't be doing this. And then they should get up from the bed, go to the toilet, and then finish emptying their bladder. And that trains that over time trains the brain, and it's shown to be very, very effective. So actually, the first medical treatment is actually no medicine whatsoever, trying the alarm, but we do it's effective. But it does actually affect the whole family, because everyone in the house is woken up by this. And then you do get medical treatment. So they've made an analog of that hormone that we spoke about, the antidiuretic hormone. It's called desmopressin. So we can, if we find that the children are overproducing urine at night, then we can supplement that hormone, and it's given about an hour before bed, an hour after supper. And it should help the children to remain dry at night. And then there are various treatments. If we think that the child has an overactive bladder, then we use medications that just help relax the bladder so they don't unintentionally just contract in the middle of the night while the child is sleeping.
Side effects of the hormone, and
Mm,
when would you, as a pediatrician, or the family or the parents decide, okay, we think,
let's do
and
it.
how do they monitor it, that it's reached a point where we do believe he's now dry or will continue
Yes,
to be dry, and you then wean them. And I should
yes,
imagine that's important as well, weaning
yes.
them off the medication. To talk to us about those issues.
Mm. So the side effect of the hormone, actually very few. The main potential issue with the hormone treatment is, I mean, it doesn't affect any of your other hormones, growth hormones, or hormones that should be released during puberty for maturity reasons. It has no effect on those. But what it can do is, if you take the hormone and then the child had to drink a large amount of water, it can be detrimental to that child, because what will happen is now you can't produce urine, and actually what you end up doing is you end up diluting your sodium levels, and that can unfortunately result in seizures. So this was actually quite a big problem that doctors wrestled with for a long time, because they thought, oh, we're going to have lots of children having seizures on this hormone. But in fact, we've been using this for over 30 years, and the number of case reports that have been published in the literature is probably less than 20 children over the 30-year period. Because I say, most of these children are younger, so you as a parent just need to make very sure that once they've taken the hormone, they wouldn't, and don't drink any water, but they'd have to drink a large amount, over a litre, and that's very unusual that a child's going to drink a litre of fluid between supper and going to bed. But apart from that, there are some one or two reports saying that might affect the children's behaviour. Sometimes they become a little bit more, perhaps, I'm trying to think, more difficult in their behaviour, but that's a very, very rare side effect. And apart from, I say, it's more the sodium problem that you need to watch, that these children don't drink a large amount of fluid. And then the recommendation is you should try it for 3 months if it's working. And then after 3 months, you wean it over about a 1 to 2 week period. And then you hope that the child has started to produce their own hormone, and then they should be dry. If it doesn't work, then you can go back onto it for another 3 months, and to a degree, you use it for as long as it's needed to be used.
So undoubtedly, this is therapy that is going to be monitored closely between parents and you as the doctor, because
Yes,
parents won't know when and how, at what point
yes.
they reach where they think that they've been successful. To wrap up then, are there newer therapies on the market? And, what
Mm,
is, what does it point to regarding keeping kids dry from an earlier age?
mm. So, there, from the hormone point of view, there has been some developments in terms of, it used to be in a simple tablet form that you would swallow, but they knew that unfortunately, if you took it too close to your supper, it could affect how effective the medication was. So there's a new formulation which comes in what they call a melt. And this is just a little tablet that you put under your tongue, and then it slowly dissolves. And so this has been, certainly I've had some children who've been on the older formulation and then come to see me, and we've started the newer formulation, and it's worked. And in fact, the manufacturer is now only making the newer formulation. So the old tablet is disappearing off the market. So that's that in terms of that one. There are some hormone in terms of trying to relax the bladder. There are newer medications that we're using in the pediatric space that adults have been using for 10, 15 years already. It's just that these medications were never tested in children under the age of 18. But because we know some of the older bladder relaxing medications don't work very well, we've now started to use these newer medications, and they've shown to be very safe and very effective in children. So unfortunately for now, it's still about the overall treatment is making sure that they're sticking to fluid intake targets during the day, trying the alarm. If they're not producing the hormone, trying the hormone, and then sometimes the bladder relaxant medication as well. In terms of training children earlier, unfortunately, that just doesn't have any effect on long-term wetting. It's really a physiological thing. Like some children, babies will be walking before others, and babies will be talking before others. It's a physiological developmental thing that we still don't quite understand. But you're going to have a small population, I say over the age of 9, who will continue to wet their beds. And the treatment is aimed at just treating their symptoms and waiting for their own physiology to catch up.
We're going to wrap up now, but one very quick question. Is it necessary for the child to undergo psychosocial therapy as well, in conjunction with medical therapy?
Yes, it really does depend, and it really depends on the age of the child. Some children at the age of 7 don't really care for wetting their beds, and it doesn't affect them psychologically at all. But it may, if they continue to wet their bed, we do see then some children teenagers who come at the age of 14, 15, and certainly it's starting to affect their quality of life. So yes, while we're trying to, to get treat and treat their symptoms, yes, sending them for psychological therapy is important at the same time. And there may be other stresses in the family as well, which need to be addressed. Although that's not the cause, it will certainly add to the stress and to wetting.
Dr. Jonathan Buckley, Pediatrician and Pediatric Nephrologist. Thank you indeed for your insights on this very important matter. Loved listening to you talking. God bless. Thank you and go well.
Pleasure. Thank you very much. Goodbye.
It is 4 minutes after 12 o'clock. This is the Mid-Morning Show with me, Julie Ali, and our next guest standing by to talk to us is Karabo Zakira Masekwameng. I hope I'm saying that correctly. And we're going to be talking about Child Protection Week. So please do stay with us. That is an important discussion that we're going to be having this morning.